Anna Grill was a 38-year-old, healthy, active wife and mom of two daughters, ages 9 and 7. She was busy climbing the corporate ladder, president of the PTA at her daughter's school, and living the life she'd always wanted. But then friends and family began noticing a change.
I had this slight tremor in my left pinky that directed me to go to my doctor, and before I knew it, like 3 months later, I was diagnosed with Parkinson's, and I just didn't even know what to think. I mean, I was blown away.
As the youngest and only female on her leadership team at work, Anna decided to keep her diagnosis a secret, worried that her colleagues would begin to see her more for her disability than her abilities.
When you start that isolation of not telling and having that secret, it's very hard to break because there's never a good time to tell people about it. So I think those of us, especially those of us that don't want to be pitied or provided sympathy, we tend to hide it. And I hid it for probably 10 years.
When her symptoms began to impact her efforts to lead her team at work, Anna chose to reveal her diagnosis to family and friends. As she began seeking resources to help her find a way forward, she soon realized no such resources existed for the young onset population. Out of her own need, Young Onset Parkinson's Network was born.
I decided to start the Young Onset Parkinson's Network, and we're now in 48 states and 17 international countries, which is unbelievable in a very short period of time, but it goes to show you the need that was there for coming together of people of like age and issues. And we have a lot more to do, so it's been very exciting and fulfilling.
Despite the challenges of living with young onset Parkinson's, Anna continues to advocate for others with the disease, growing a supportive community that helps them live well and thrive beyond diagnosis.
Yeah, I definitely could relate to Veronica quite a bit in the movie. Like most women, she's this very strong character and really took the opportunity to turn a bad situation into a good one with all the work she did with the boxing studio and whatnot. Um, when I got diagnosed, my kids were 9 and 7, and and I was at the height of my career, doing really great things at work and balancing it very well with home. And as you saw in my video previously. But yeah, I mean, as women, we tend to take on a lot and we don't tend to ask for help. So that gets to be a pretty hard combination when you're diagnosed with young onset. I was 38, as you saw. And yeah, I just forged ahead. Like I didn't stop. I didn't think about it much. I just, I got treated for it and I kind of put it on a shelf and just kind of lived my life from there. Okay, yeah, that's a good question. So my husband obviously knew, my parents knew, my brother knew, but I didn't tell anyone else outside of that, really. Not my friends, not my kids. I just felt like it wasn't, it's not a fun topic. It's not like party conversation, and it's also kind of complex. So, you know, when I finally told people, which was much, much later, I actually used email because I didn't want pity and I didn't want to get emotional, and I didn't want to be felt sorry for. So it's a really tough disclosure, and I'm not sure why we all feel so like almost like shamed about it. But I think it has to do with the fact that it's known to be a neurological condition that's degenerative and has no cure. So what is someone going to say to you when they hear you have it, right? So but it really affected my life the most from not telling my kids sooner. Like I said, they were 9 and 7 when I got diagnosed. I didn't think that I needed to bring it up to them. I didn't want anyone at the PTA or anyone in the school to know, because I wanted to continue doing what I do. And unfortunately, I waited a little bit too long. I told them when they were like 14 and 12. And it turns out that my 12-year-old had already kind of figured something was up. And she looked at my medicines in my medicine cabinet, and Googled them and self-diagnosed me with Huntington's disease, which is fatal. And that was just heartbreaking, because I don't know how long she knew that for or when she had done that, but it was a good amount of time before I told her myself what was really going on. And that impacted our relationship for many years thereafter. from a trust perspective. So that was definitely a do as I say, not as I did. I highly recommend that you be more open about it with kids. I think there's a lot of great resources now that help you do that through child books and things like that. But yeah, it was not a good situation for me, unfortunately. That was, but in other ways, I'm glad I didn't disclose it at work and whatnot till I had to, because I did very well thereafter for the 10 years, and I wouldn't have wanted to have that taken away from me, sooner. So it's a crapshoot as to how you handle it. Everybody does it differently, and there's really no right way. So, yeah. Oh, there's quite a few. Well, one is that they think it's just an old man's disease. And, it's easy to think that because of the way it's positioned in the media and whatnot. But, it's almost a 50-50 split, I believe, gender-wise now. And the young onset group is growing at a faster clip in some studies than the traditional older age onset group. Why is this? It's hard to say. Is it because diagnosis is getting better, or is it because the environment's getting worse? There's a lot of theories on that, but it's definitely not your grandpa's disease anymore, both from the standpoint of your treatments. There's a lot more options with treatments that can keep you well for years. And from the standpoint of the disease itself and how it, who can get it and how it manifests. So.
Yeah, I think a lot of people are going to connect with that. So thank you. And
the other one I would say is that, it's not just a motor symptom disease. A lot of people just think it's the tremor and the, maybe dyskinesia, which is the wild, like, big motions that you might see sometimes people say, or people have with Parkinson's. It's very much both. It's a complete disease in the sense that it affects internal systems too. And a lot of people don't realize that. Things like sleep disorders are very common, digestive constipation issues, autonomic issues, controlling of temperature in your body, not being able to get warm when it's cold, not being able to get cold when it's hot, and things like that. So, it's a lot more than meets the eye, I guess I would say.
Mm-hmm.
Sure. I have kind of my top 5 that I think keep me well, and that's going 17 years into the diagnosis. I'll be 55 next month, and I still am going strong. So I hope these will work for others as well. The first one is not surprising if you know anything about Parkinson's. Exercise and nutrition is huge, and the best thing you can do, in fact, the only thing that's been shown scientifically to help slow the progression is exercise. So you need to consider exercise as one of your main medications and do it daily. And it needs to be high impact exercise for at least 30 minutes a day that gets you breathless a little bit. And that helps with the dopamine production in your brain, and it helps protect what you have left. Because that's what causes Parkinson's, the loss of the dopamine. Nutrition wise, they recommend not too different than everyone, that a Mediterranean diet is a good diet to follow. And the second thing is a partnership with your doctor. You really have to find a great physician, and you want to get a movement disorder specialist, not just a neurologist, not a general neurologist. You want to get a neurologist that is certified in movement disorders. And you really have to be proactive about your health, because they're only seeing you like for 15 minutes out of every 3 or 4 months if you're lucky. And you have to really be able to advocate for yourself and speak up when you're with them to let them know what you need. But with today's medications and treatments, they should be able to help you stay, living a very good level of life for a long period of time, if you're with the right doctor and you have the right partnership. Connection is big too. So I talk a lot about that. Stay connected. One thing that people with Parkinson's tend to do is they shelter themselves. They stay inside. They don't want to show themselves because they're embarrassed about their external symptoms. The best thing that you can do is stay social, stay connected to both your prior to diagnosis Parkinson's friends, and actually you're going to get a whole new set of friends that are just wonderful people in the community. And that has been, one of the one of the few positives I could say about the disease is you do meet a lot of wonderful people. So take advantage of that and live to the fullest and stay connected to the outside world. The fourth thing is purpose. So this hit me, and especially when you're young onset, you may not have, your purpose may be different now. You may not have the same purpose that you had or that you thought you wanted, but find something you can do to keep a purpose in your life. So for me, that was starting Young Onset Parkinson's Network. I was able to continue to leverage, my skills as an executive leader that I had when I worked. And, you need to have a reason to get up every day and do something good for everyone, especially yourself. So, and the last one is probably the biggest one, and that's attitude. I've seen the success of people with Parkinson's be directly tied to the attitude that they bring to the every day. So if you decide that you're going to, despite this disease, you're going to find a way to continue to thrive and enjoy life and have a great relationship with your family and friends, that helps a lot. And it's the people that kind of give up and don't do all those things I just talked about, and they don't have a good attitude about it, that it's almost like the physicality is directly proportional to, the mental state. So find a way to stay on the positive side of things and, be grateful every day. I practice that every day. There's a lot, you can always find someone who's worse off than you, as they say. And, you need to be grateful for what you can still do, not regretful about what you can't. So that would be my suggestions. All right. So I encourage you all who may know someone who has young onset Parkinson's, or who has it themselves, or is a care partner or family member of someone who does, to take advantage of the free membership that's offered through Young Onset Parkinson's Network. So please join us. It's a good place to be, and it's a good place to find support to help you thrive for a long time post-diagnosis. And I want to thank NPT for having me on. I really appreciate the opportunity to spread the word. And if you want to learn more about Young Onset Parkinson's Network, you can catch us at yopnetwork.org.
Good evening, everybody. Welcome. Thank you for taking time to come and sit and learn and listen. I think you'll find this much more engaging and educational than the same things that you're used to hearing from the same people, from the same doctors, from the same pharmaceutical reps that you're always hearing it from. So this is something that won't be regurgitated. As I said, my name's Larry Zarzecki, and I'm a Parkinson's patient. I was diagnosed with young onset. My career began many, many years ago. And I think what I really want to start off with is I knew that something was wrong, but I couldn't articulate what was wrong. I just didn't understand, but I knew it was something. What's interesting about the movie you just saw, as most people in this room, some of you I've known a very long time, and some of you I haven't met yet, but look forward to, is that it's the little things in life that you never realize you're losing. Parkinson's is a beast that just sneaks in, and it's a taker, and it takes, and it takes, and it takes. It takes your ability to think properly, your cognitive functions. It takes away your spontaneity. Spontaneity or spontaneity?
No, you had it the first time.
Spontaneity. And if you see me struggling for a word, don't be afraid. Please help me out. It takes a few minutes for things to work through the superhighway. And you have two very interesting people here Sarah, who is just a fountain of knowledge, and I think we both really believe, we all know Parkinson's patients, right? Caregivers, right? We all know our Parkinson's, we all know our people with Parkinson's. It's the caregivers that are the real heroes. Not only is it the caregivers that are the real heroes, but it's people that we never met before that were there for us, that helped us get a new start. I was a medevac pilot in my first career. My second career led me to another career as a medevac pilot for the state of Maryland. And it was probably 10 years in to that career, I knew something wasn't right. And the more I tried to explain to my doctor something wasn't right, fatigue, body aches, shoulder aches, this hump that I was getting, I couldn't figure out this hump. And he started prescribing me some medication. The medication made it worse. And I didn't know why. So I came out of the pilot seat for a while and did some desk duty. Tried to talk to my family about it. And it's fatigue, like the doctor said. Let's go on vacation. Had a miserable time on vacation. It took 3 or 4 days just to start to feel somewhat normal. And then I would take the medicine, and then I'd be tired and fatigued all over again. Well, it led to one day I realized that I wanted to start moving, and I couldn't move. And that's when the world really changed for me. I had what's called a freezing episode. And a freezing episode is a temporary paralysis. The lady that you see, she has just the opposite. She has the flailing effect. I have a stutter step where I'll start and part of my body will say, Larry, that's a great idea. Let's do that. And then the other part of my body will say, nah, we're going to screw with you. We're going to stay right where we're at. And that's exactly what happened and when my life changed. I was at the top of some steps and it was, okay, it's time to go down the steps. Well, go down the steps, you go down the steps, walk down the steps. Well, the bottom of me said, nah, we're not going to do that. The top of me said, let's mess with him. Let's go. So the bottom part of me did not follow the top part and face first, head first, down 14 steps, I went. I was lucky. There was a metal pole at the bottom of the steps that was a brace for a foundation, and I hit it dead center. It totally destroyed my neck. I was in a coma for 11 days, and I had a serious brain bleed. So I woke up 11 days later, and I was in a trauma center in Baltimore, and I couldn't move, I couldn't talk, I couldn't communicate. My eyelids were taped open. They were very dry. I had all these tubes and monitors connected to me. I couldn't understand what they were. And after a few days passed, I wasn't really sleeping that I can remember, but I really wasn't awake that I can remember. I'm just not sure what really happened to this day. And the interesting part is that I was given a 12% chance of being a productive human being again between the brain injury and the bleeding on both hemispheres of the brain and the total destruction of my neck. Well, I wish I could show you guys a picture of it, maybe another time, but I have it's all instrument fused. It's all hardware now, from my shoulders all the way to the base of my skull. And some of the vertebrae, or vertebrae, had to be replaced with cages and hinges. And as you look at me, as I've aged, the scars are becoming very pronounced, where I was cut from the back of my head pretty much all the way around and inside of my mouth. And they made the repairs. Well, it took about 20 months, and I actually became a productive human being again. And I became that human being again by starting to learn to grunt and make noises and wiggle a part of my body and do a lot of drooling and learn everything from a newborn, from how to use a spoon. I've still have the opportunity to get into the hospital occasionally, and I learned that the motion was, I understood what they meant by toothbrush, which was evidently really good. I would have never thought. I really wouldn't have. So it took 21 months, and through that 21 months, it was interesting, and the doctors and nurses that knew me from bringing patients in and out of the hospitals knew that if I recovered, I would want it documented. So pretty much every step of the journey is documented, all the way down to learning the remainder of walking at the VA center, at the VA Robotics Center in Northeast Baltimore. And that was incredible, and I still talk to those people to this day. So throughout that journey, I lost somehow my person and my best friend. She had to do what was best for her and hasn't spoken to me since. Thank goodness her and my son still. So while I was recovering, I noticed there was a gap that needed to be bridged in the way medical professionals communicated with one another. And that helped me exercise my brain and become social. And I believe, unlike Anna and I have known each other for many, many years, and she's probably on a funny note, one of two people that speak so quickly that it just erases my brain. I couldn't buy a thought if I had to. They must have given her a tranquilizer when they did the interview with Anna. But Anna and I have been from one side of this country to the other, lecturing and doing what we do. So now that I'm back on track, I started a nonprofit, and the nonprofit grew and grew and grew. And as I started to learn to talk, I talked to some of the most incredible people that I ever had the opportunity to talk to. You hear about these people, but you never think you're going to have the opportunity to meet them. And so we would talk, and there was a neuropsychiatrist at Johns Hopkins. He's no longer there. I think he recently left and went south. And he was a big part of, you have a point. Whether you break an arm or have some sort of trauma. Trauma is different for everybody. You should have somebody to talk to. Socialization. We're meant to be social. We're meant to be social. And without that socialization, you can exercise all you want, but that's not going to help your brain as much as socialization. Don't get me wrong, it's all important. The medications are important. Parkinson's is actually, it's a beast. It's a beast. And it's unforgiving. Have a sense of humor. I do. I've mentioned to friends of mine before, yeah, I'll meet you in the garage. Well, I didn't realize that I wasn't paying attention, and I literally almost met them in the garage through the sheetrock. So it's little things like that. My son will come walking through, or one of my grandsons will come walking through, and I'll just be laying on the floor with my electric toothbrush, wrestling with it, and I don't even want to know anymore. So it's just so great, and things have progressed so much in the past few years. Parkinson's runs in my family. My grandfather had it, and he lived to be 62. Back in the 70s, he was just known as feeble. And he was the poster child for Parkinson's. He couldn't stand up straight. He was 6 feet 5 inches. He couldn't stand up straight. He couldn't pick his feet up. He had mood swings. He was harmless, but my grandmother just would say, don't pay any attention to him, he's feeble. And she called him Buck. His name was George. Come on, Buck, what's the matter with you? Straighten up. So I would compare some of the things that he went through with some of the things I would go through. The John Wayne walk, the contests of why do you always have to push the shopping cart? Well, I'm telling you something's not right. I need to push this cart so I can stand up. So I now take an out-of-pocket expense of $3,800 a month in medication between depression, anxiety, other non-motor symptoms that you don't see, urination, constipation, depression, anxiety. Oh, there's nothing. You haven't had fun until you've had a dose of anxiety on top of depression. You know, that's no fun. You got to have one with the other, right? That's when it really gets fun. So, with that being said, I'm not a candidate for DBS, but I will be going in September to Phoenix, Arizona. I was accepted into a trial for the new external that's really popular in Australia right now, and they're having great success with that. And I'm excited for September. And I just don't know what else to say other than it's an adventure for each one of us, and we're so lucky that we have Drew and Sarah here. And don't be afraid to say, stop, shut up, because since I've learned how to talk, you can't shut me up. So I'm going to turn it over to Drew right now, because Drew has some really exciting news from the Fox Foundation.
Absolutely, Larry. Well, I appreciate it. Again, Drew Hatter with the Michael J. Fox Foundation. My role, I'm actually in government affairs, government relations, actually, as we would say. I'm a government relations officer, so I do a lot of advocacy work. Particularly for me, it's with our federal government, but our entire team does federal government, state government here in Maryland. Quite a lot of work that, Larry, I know you've joined with a lot of that as well. And so, but yeah, I think some of the things that Larry kind of was alluding to there, you know, is many of the challenges that have been identified. And, you know, I'm struck by the documentary speaking about carbidopa-levodopa, right, which is the gold standard, as was mentioned. But it's a decades-old, you know, treatment, unfortunately. And DBS, which shows so much promise, but Larry, as you mentioned, you're not a candidate, unfortunately. And I think it was really captured so well, a lot of the considerations that a lot of folks have to make when they're thinking about such an invasive brain surgery, right? And so while that kind of underscores the lack of options that are currently available, there's so many things that really, for me, are very exciting that are on the forefront, right? So last year, we kind of have the breakthrough of the first ever biomarker, right, in Parkinson's. I'm sure many of you have heard of it. For those that haven't, right, for the first time ever, it's actually a misfolded protein, a protein that's not doing what it's supposed to, right, that's found in the brain, and that's been shown and validated to be correlated, to be associated with Parkinson's disease, right? And so for the first time in patients, we can now test that, we can show that. Not only can we show the progression of that disease a little bit better in folks with Parkinson's, but we have a really useful tool that we really feel is going to absolutely speed up clinical studies, the development of new treatments, new devices, new things of that nature. And secondarily, kind of a 1-2 punch, right? That's really paved the way for a new staging framework and new sort of clinical, not quite clinical yet, we're hoping to have it in the clinic, but a new research framework, a staging framework for Parkinson's disease, right? And that is now, because of this biomarker, because of biological evidence and the kind of the growing knowledge there, for the first time it's based on those biological markers instead of the outward symptoms and the inward symptoms that you mentioned that are particularly hard to monitor. You know, I think for the past many decades, our understanding, evaluation, and research of Parkinson's really has relied on those outward symptoms. And of course, as we mentioned, the very visible ones are the motor symptoms, but not everybody struggles with that. Not all folks with Parkinson's have uncontrolled movement and tremor, right? As you mentioned, you have freezing episodes, rigidity, stiffness, I'm sure, balance. Yes, yeah. And so finally, we're kind of entering what I know a lot of our researchers, and I think the research community in general, is calling the biological era of Parkinson's, which really just has, I think, the opportunity to catalyze so much of this here. Another interesting thing that I'll point out, another example of great work that's been done. We've as a part of a global coalition of folks, of which, you know, Michael J. Fox Foundation is only a part of. They've identified a genetic risk factor as well for those with African descent, right? That shows the onset or the higher risk correlation of Parkinson's as well. And we know that there are many genetic risk factors, and this is, you know, one such new one that really, I think, highlights the need for additional study in underserved communities and minority communities as well. So there's many exciting things that are happening. I think, you know, I'd be happy to talk about it more. I don't want to go over my time. I think my role, what I see there, I'm not a scientist. I wish I was. I guess my grades weren't quite good enough there. But, you know, on the government, on the policy side of things, Larry, when you're talking about the exciting clinical trial and the exciting opportunity you're going to, kind of what my work, my team's work, our team's work at the Fox Foundation, our public policy department, is trying to find better ways that the government can be a partner in that, right? That our federal institutions, our federal agencies, our laws, our local laws, our state laws, right, can help support the Parkinson's community and accelerate research. And it's not just about the research, it's also about the access to better prevention, better diagnosis, better treatment. But these are the kind of things that I hope, you know, the advocacy community can kind of help with, making sure those clinical trials and things that you're so looking forward to and excited for that they continue to be available. So
you guys make so many things possible.
Oh, well.
And we can't thank you enough. And that's not only from the patients, but it's from the caregivers also. Yeah. And it's just an incredible job that you're doing. I see you all over the place, from Washington to right here in the state. You're just all over the place.
Well, I appreciate that, Larry. And if I could mention one more thing too, you kind of remind me, you know, particularly us on the, you know, the government relations, the government affairs, we're just one small piece of that. We can't do our job or do it very effectively without the advocates, without the professionals, without those living with Parkinson's, the caregivers and family members of you, as you have mentioned so very often. That really is what advocacy for us is all about. I can go into an office or I can talk to an individual about Parkinson's and share the numbers, share the top lines, and that's great. We can, you know, we can educate and we can learn, but it's really not until we can kind of bring the human face and those experiences to it that it kind of makes an impact. So can't do the work without you.
Would it be okay if we had a question and
Yeah.
answer from the audience after we hear Sarah?
Sure.
Would that be okay, everybody? Okay. Sarah?
So as I was introduced, I'm the health educator at the Johns Hopkins Parkinson's and Movement Disorder Center. So what that means is I'm not one of the doctors. I am there for resources and guidance and questions and information. So support groups are huge. That's one of the main things that I would advocate getting involved in, because as we saw in the video and from hearing from Larry, you know, socializing and talking to other people in the same position, even though it's not the exact same position, you know, you've seen one, not them all. Those are so valuable, and there's all different types. You can get involved in educational support groups or sharing support groups. We have young onset, we have newly diagnosed, we have care partners, we have atypicals. I mean, there's something out there for everybody, and I highly recommend getting involved, whether you are a person with Parkinson's yourself or just looking to learn more and support the people in your life. Getting involved in research is huge. That's a great way to give back to the Parkinson's community to help move forward the treatments for a lot of these issues. I could go on and on about all the different things that are available to you. There are amazing organizations in the area. Hopkins offers a lot of services, whether you are a Hopkins patient or not. We also have really great institutions like the Maryland Association for Parkinson Support, MAPS. They are huge in offering exercise classes and educational series and support groups, anything that you could want. They're a great resource for that. This is turning into sort of like my table out there where I'm trying to cover a little bit of the generals on top, but if you look underneath the table, I've got a whole big cart just in case anybody asks a more detailed question. But I do recommend, you know, signing up for our email list or going and visiting the websites of the Parkinson's Foundation or of MAPS, finding out more information about what's available to you. Get in touch with somebody like me to ask your questions, to get pointed in the right direction if you're not sure where to go, where to find the help and the answers that you need. There's endless resources out there. There's so much that can be done for any issue that you might have going on. So don't be shy, don't be afraid to reach out to one of us and ask for some direction and ask for some help, because there's so much that we can do for you.
Sarah, could you just speak a moment on what's available for the forgotten sector, our caregivers?
Yes.
Please.
Yes. I don't remember the exact dollar amount, but there's hundreds of billions of dollars of unpaid labor done by care partners in the U.S. You have the number?
12 billion according to ARP.
12 billion?
In Maryland only.
12 billion in Maryland
12
alone. Billion.
in Maryland.
That's wild. So the care partners are so vital. There's a lot of research showing the difference in the prognosis for people with Parkinson's who have an involved care partner. Just having somebody that is in it with you, somebody that goes to your doctor's appointments to learn more and support you better. But these care partners need support as well, and so we take that very seriously. We do care partner screenings to try to see if there are more resources we can deliver to the care partners. If they need a support group or they need to be connected with financial assistance or respite care so they can go to the grocery store by themselves. You know, there's so much available out there for everybody involved in this equation that just absolutely reach out to us and let us help you find the best services that are out there for you.
Thank you, Sarah. Before we open up to the question and answer session, I just want to say thank you. Thank you so much, because we're so fortunate to have Nancy Carr and Hank Greenberg, the Maryland State Director for AARP, who stands so strongly behind caregivers, the Parkinson's issue, and issues related to people of our age, 50 and older. So this is a great opportunity to ask not only us a question, but grab them when you're in the hall, or ask Nancy now. She's incredible. And we have Hank over here. How many people know that Maryland is one of 6 states to have a Parkinson's registry? Did you know that? Maryland has a Parkinson's registry that was adopted overwhelmingly, with the exception of one or two holdouts of our legislature. But the legislature itself is so incredible to work with. And AARP was there every step of the way, along with Hopkins and the Fox Foundation and all the other foundations out there. So Maryland, once again, is stepping up. Think about that a minute.
What does
Now,
it mean to have a Parkinson's registry?
that is a great question. That is a great question. And the first report just went in recently. I was asked to join the board, to be a board member, to get it off the ground. And what it means is it's expected to have an incredible socioeconomic impact on not only our working class people, but our unserved and underserved populations also. So what the idea is to get a projection, and it's totally voluntary. Your information will not be out there. It's all numbered, and the board is using information compiled from CRISP, the Chesapeake Regional Information System, which links your different hospitals, am I right about that? The different hospitals and healthcare institutions together. That's why now when you go to the doctors, they already have your chart and know what's going on. So it's going to allow the state to ask for more. The idea is, let me rephrase that, for us to be able, and that by us I mean all of us, to be able to get more federal and state funding for not only Parkinson's, but the comorbidities that it creates. Dementia. There's so many different types of dementia. That I'm hoping will be looked at, because there is a Parkinson's dementia. And it's just so exciting to watch this come together. So with that being said, let's have some questions. Nothing is off limits right now, especially for me. Urination to constipation, and if you're embarrassed easy, you might want to ask Sarah or Drew.
I don't know about that. I tell people during our first support groups, if you're not comfortable, like, you're going to get there. We're going to talk about sex. We're going to talk about poop. Like, we're going to cover it all,
Yes, ma'am.
Yeah, I had hallucinations. Can we get some information on that? I mean, I didn't know what was going on for me. I mean, they take the residents in my room, when I come in, I say, go home, But at any rate, can someone speak to that? What its relation is to Parkinson?
Sure. Would you like me to take that, or would you like to take that? Would
get
you like to
started.
take that?
Oh, no.
Okay. Before my Parkinson's became under control, I had the psychosis end. My ceiling fan would play music. Seriously. The walls would buzz, and it drove me crazy. I would get up 2 o'clock in the morning, 11 o'clock at night. It didn't matter. And I would listen to the walls. Where is this buzzing coming from? And everybody in the house, my son and my wife would look at me and like, okay, we got buzzing now. But that's the importance of what the doctor I was speaking of earlier, his contributions was to this in bridging this gap that exists and has gotten so much attention in the legislature and from institutions like the Parkinson's Foundation and AARP and especially Johns Hopkins and the Fox Foundation, is we need a team. We need a team, not just a doctor. I have a team. My team consists of, and I'm really pushing hard to make my voice heard, my team consists of my general practitioner, my movement disorder specialist, a dentist, a podiatrist, a neuro-ophthalmologist, who I absolutely love because he has me seeing one of everything now instead of 1.5 or 2.5 of everything. These glasses with the pixels are the neatest things in the world. They're just incredible. So you need a team. And don't be afraid of it. Don't be afraid to say, yeah, I sit down with a neuropsychologist or psychiatrist once every 6 months or once every 3 months, and also have a coach. Your coach may be your significant other. Your coach may be leaving a message for Sarah. And by the way, if anybody wants her cell phone number, I'll give it to you afterwards.
Half y'all have it anyway.
Or, you know, and the same goes with Nancy or Drew or Hank. We'll be more than happy to provide all that for you. But yes, we need a team. It's so important to have a team throughout this because it does take, and it takes. And a lot of times, I can't understand what's going on. I don't know what's going on. Why is it 1 minute I'm standing up and the next minute I'm doing a Larry and toppling over? Why is it I can't go to the bathroom? I don't know. Can't figure that one out. Why is it I can't shut up? I don't know that either. So,
Well, that's a good cue for me to say.
yes, yes.
That it can sound intimidating for him to list off all of these different doctors to create your team. And it is a lot of work to get, you know, your perfect roster, your dream team put together. But let me tell you, it is worth it once you get that put together. And it's a lot easier to maintain that rotation of appointments once you have it all set. And it makes such a huge difference to have a team of providers that you trust, that you have that good communication with. And on the note that you were talking about the hallucinations, that's why it's so important to see the appropriate people on your team, because a movement disorder specialist will know which medications and treatments are safe for you with Parkinson's to treat those hallucinations, whereas a general practitioner may just give you a different antipsychotic medication that's actually going to cause a lot of issues with your Parkinson's. So without getting too deep into the weeds about all of the science behind that, just making sure that you're going to the appropriate care providers that can really give you the best treatment possible and give you the best quality of life possible.
How do you assemble that team, and how do you get them to? How do you make sure that they're talking to each other?
Yeah. Larry can probably speak some about his experience in doing this, but it can be helpful to keep them within the same hospital system for communication. But these days, most people's electronic medical records can be read from one institution to another. Start slow, prioritize, go to your movement disorder specialist to see what symptoms are a piece of your Parkinson's and what's another issue to go to somebody else. What are the most pressing things that are affecting your quality of life that you want to get addressed first? Just take those steps one at a time. You don't have to do it all in your first 6 months with Parkinson's. Just work through the symptoms and figure out what your priorities are and what's affecting your quality of life. Did you have any?
Yes, sir.
Sarah, I wanted to follow up with that. What is the incidence, the incidence of misdiagnosis?
So I don't remember if it was in the video or if Larry was talking about it. A third of Parkinson's patients never even have a tremor. So with some of these lesser known symptoms that they present with, it can be difficult to get that initial diagnosis or to maybe be diagnosed with something else. If you have an atypical Parkinsonism, it's extremely common to be diagnosed with Parkinson's, and it takes a few years to really see where the course of that is going before you get the exact diagnosis. So I would just say, if something doesn't feel right, get a second opinion. If your questions aren't being answered, if your concerns aren't being addressed, seek out more information, seek out somebody that can answer those questions until you feel like you've really gotten not the answers you want, but the correct answers. Does that answer your question at all? Okay.
Yes, ma'am.
What does the movement disorder specialist exactly do to help it improve the quality of life?
Sarah.
Yeah. So a movement disorder specialist, that is a neurologist. They've gone to medical school, then they've done their residency in neurology, and then they go on to do a couple more years of a fellowship in movement disorders. And a large portion of that is going to be Parkinson's disease. So that means that they have more expertise in all these other little symptoms, the sleep disturbance, the constipation, the drooling, things that you may not think of as being a Parkinson's symptom. They are better able to screen for those things, to know how to respond to those things, and really be able to tease out, to some extent, what is affecting you the most, what the best course may be to treat it, because there's going to be weighing pros and cons of any treatment. But they can really help you figure out what your options are in treating those symptoms.
It's more assessment-based than treatment-based.
I mean, there is a lot of treatment, but unfortunately in a disease like Parkinson's, we can't treat the disease itself. We can only treat the symptoms that are bothering you. So there is a lot they can do to treat those symptoms, but it does take somebody being able to assess for them in the first place to get the appropriate treatment.
And if I may, don't be surprised if you learn that your movement disorder specialist is a psychiatrist or a neurosurgeon. They have more than one specialty. So they have their specialty, and then, as Sarah was saying, they go back to school and enhance that education into a more, what word is it?
Subspecialty.
Yeah, subspecialty to be able to do it. Now, you are going to have impasses where you just don't agree with your movement disorder specialist. It's perfectly common. I have impasses with mine quite often because I just could never understand when I would go and ask a question. My movement disorder specialist would say, well, that's really not Parkinson's. Well, explain it to me. Well, his explanation or her explanation was up here, and my understanding, without having a medical education, is down here where the average person is. And it was like, okay, how do we get to the point where we can have you dumb it down so I can understand it? Talk to me like you're talking to your child so that I can understand what you're saying. And believe it or not, it still took a few years, and all of a sudden I had an aha moment. And the aha moment was, I get it now. He's absolutely right. She's absolutely right. Parkinson's is the death or lack of dopamine production, and everything else that's happening is a comorbidity or a byproduct, kind of, in a way. Pretty safe to say?
Yeah.
So when I get up in the morning, my regimen is usually, these shoes go on because they're hard shoes. I take my carbidopa levodopa. I walk from my bed to the shower. I take my shower, and by that time it's around 5 a.m. and my medicine is kicking in. So what does that mean? Larry, you're okay to start your day by pushing that coffee pot button. I don't fool with the stove. If I can't microwave it or take it out of the refrigerator and peel it with my hand, like the little tiny oranges that I'm hooked on right now, what are they called?
Clementines or cuties.
Yeah, that's it, clementines, the little clementines, because they don't have seeds in them. And the vitamin C is great for you. So yeah, the stove is off limits for me. Because I live by myself, I'm my own caregiver, and I'm always thinking to myself, you know, Lair, if you just stopped, which is what you want to finally happen in the end, you just want to stop. is Kevin or one of the boys or his wife going to come over and check on me? Are they going to walk across the house and through the breezeway and over to the chicken coop where I'm at and check on me? But he tells me all the time in a joking way, Dad, I want you to practice this. Okay, Kevin. State facility. So you better believe that I make sure that with the help of Nancy and Hank and the entire staff, and we have her hiding in the back, Dawn Lewis, with everybody's help, I stay as social as possible. I really do. I stay as social as possible. And when you guys leave here, I have very bad short-term memory, but there's always one person that you can, for some reason, always remember. I walked in here and I almost fell over dead on the spot because I saw my old friend, Mr. Schwartz, who has been through everything life could throw at him. And lo and behold, he's sitting here and he says, "Hey, Larry, how you doing?" And I was like, holy crap, Mr. Schwartz. And I actually met his wife for the first time. How incredible is that? So if you can catch him in the hallway, please do. And I know I'm being long-winded, but it just goes to show you that socialization is a great medicine. Mm-hmm. And if you think of your brain as a muscle, you have to exercise it. What's the best way to exercise it? Use it. Right?
Yeah. Socialization is huge for maintaining cognition, mood, all of that.
Yeah. Can we get a question for Drew?
Terry.
Yes, ma'am.
What's going on with the Parkinson's, the funding for Parkinson's? It's in the Senate right now, I think.
Oh, the national plan
Yes.
to end Parkinson's. Yes, spent most of my day thinking and working on that. Actually, yeah. So for those that aren't familiar, the National Plan to End Parkinson's Act, it's a federal bill, legislation that we're trying to get through Congress in Washington, D.C. So we were thankful to get it passed out of the House of Representatives, so we're halfway done. It's currently sitting in the Senate. We're trying to get them to take that up and take further action on that. You know, not too much going on in the world or any other priorities that they have. Well-oiled machine over there, right? So it's been quite the easy lift. But no, we have a lot of great partners that we're working with in the Senate, trying to find some space and time to get this moving. But kind of backtracking a bit, right? What this bill does, it's the first legislation to unite the federal government in a mission to prevent, diagnose, treat, cure. Of course, Parkinson's really mindful of that whole spectrum of approaching the disease. And how does it do that, right? It directs the Secretary of Health and Human Services, one of the cabinet secretaries, one of the big agencies, right, in our federal government, to establish a national plan to end Parkinson's. We didn't really reinvent the wheel when we named the bill there. But the practical piece of that is it sets up a committee, an advisory council to really, and it's of all of our major players in our federal government, but importantly, the non-federal folks as well, physicians, researchers, people with Parkinson's, the care partners, very importantly as well. Partners. You have to forgive me, my thing is going off as planned. But yes, and so the point there.
Did you guys just see that? Did you see it? What was the first thing we were asked? Drew, come on,
I'm
dude.
sorry, it was one of my...
Turn your phone off.
Oh my goodness. It was an alarm. I was silenced, but those alarms cut through. But yes, anyway, so it's to better coordinate our federal efforts and our research around Parkinson's. So we're working hard. We're trying to get some time in a Senate markup or a hearing in the Senate Health, Education, Labor, Pensions Committee. It's the committee that handles a lot of the healthcare policy in the United States Senate. So we have two great champions, Senator Shelley Moore Capito from West Virginia, Senator Chris Murphy from Connecticut, Republican and a Democrat. We have 38 co-sponsors, I believe, on the legislation. We just added Majority Leader Chuck Schumer as well, most powerful senator in the country, onto that bill. So we are very optimistic, hoping to see that moving along here in short order. So.
And can't people still sign the petition on your website?
You absolutely can. Thanks for reminding me one of the most important things. We have a whole litany of different ways you can get involved, one of which is signing a petition to advance the national plan. We have over 25,000 signers of that so far. We're looking to keep raising those numbers, particularly as we're in Parkinson's Awareness Month as well. So one plug I'll make, the quickest way to find any and all things for us on our advocacy is to go to michaeljfox.org, that's /advocacy. And so even if you just go to our website, hopefully you can find the advocacy resources as well there.
And if I may, because they're close to my heart, as well as the Parkinson's Foundation is, please go to the AARP website.
Absolutely.
And you'll see a lot of interesting and legislative issues that are moving forward because of all of their hard work. And if you don't already have one, I think you can see Sarah or you can see Dawn for your Aware and Care kit. I still have mine. His name's Harry. His name's Harry. Harry's looking a little thin, but he goes everywhere with me. And he's actually been a lifesaver for me going to the hospital. But AARP, we can't thank you enough for everything you're doing on the state and federal level.
I have to interject because it's Larry who represented AARP in Annapolis for a couple of years now while we lobbied not only for the Parkinson's registry, but also for one of the first prescription drug affordability boards in the country. He shared his story about his expenses for his life-saving drugs, his life-preserving drugs, and he moved mountains against, the most formidable industry in the country, who didn't want regular people to be able to figure out how much medicine should really cost. And so this board. It's taken a few years to get running, but they finally announced like the top 8 drugs that public funds pay for, Medicaid, Medicare. Also, this right now it's for state and county employees, but we hope to expand it to all prescription drug customers. But they've looked at the top 8 drugs right now on the market, and they're going to do a deep dive into the actual R&D costs to figure out whether or not Americans are being overcharged or Marylanders are being overcharged for these drugs. And if they are, they want to institute a price cap. And a perfect example that this is not one of them is, EpiPens. EpiPens, the insulin was sold for $1, the rights to it decades ago. And now, for me, my son's EpiPen went from $100 to $300 for no reason. And so the Drug Affordability Board is going to be looking at these issues. Another thing Larry did was, you may have seen him on TV, you might recognize his face. He was the spokesman for AARP's national effort to permit Medicare to negotiate drug prices. And you know that for several years now, every presidential candidate who's come along has said that that's been part of their platform, was to be able to do that. Well, thanks to Larry's hard work and his willingness to share his story and other people like him, that was part of the Inflation Reduction Act last year. And so it's going to hopefully, bring down drug prices for everybody, but especially those on, limited means and people who are on Medicare. So it's really Larry who is the success story, and people just like Larry and just like everyone in this room who step up and share their stories.
Just to follow up on what Nancy said, it's each and every one of you. It's each and every one of you that did that. And I can't thank you enough for allowing me to be your voice through that. So it doesn't matter where you're at, you do have a voice. And the amazing part is, it's being listened to. If you could have seen that board light up in Annapolis with absolutely bipartisan support and no one speaking nay against it. It was just incredible, and it's something I'll never be able to thank each and every one of you for doing,
Well,
because
that's why you also
it was you.
have to sign that Michael J. Fox. Because, you know, 25,000 is a good start. We need more people.
Absolutely, absolutely.
Well, I just want to say really quickly, thank you, Larry, Drew, and Sarah, for sharing your perspectives and resources, as well as Nancy with AARP and John with the Parkinson's Foundation. Thank you so much.
Thank you, guys.